We've had some flooding in Southwest Virginia with more than 20 water rescues overnight in Washington County. 10 homes were flooded in Pulaski and severe flooding in Abington and Bristol. As of noon, we had more than 166,000 electricity customers still without power across Virginia. This weather system is moving across Virginia, but we may still see dangerous storms and high winds through the afternoon. So I advise Virginians to listen to their local weather alerts, and if you hear a tornado warning, please take immediate shelter. Obviously, taking shelter to save your life takes precedent over social distancing. And if you're out in your vehicle and come upon high water across the road, please don't drive through it, turn around. Today, we have updates on modeling, online learning, and budget items. First, let's talk about modeling. I know most of the reporters here participated in the briefing we did at noon with our data scientist. You saw what we are seeing. I trust you saw how comprehensive the models are. I appreciate the number of great minds that are working around the clock to provide us with accurate and timely data. Since this epidemic began, I have said we are basing our decisions on science and on data. We are listening to expert epidemiologists and public health experts in our Department of Health. We're listening to our hospital CEOs as they tell us what they are seeing in their emergency rooms and intensive care units and what they expect to see. We're listening to our economic experts as we assess how deep the economic pain will be and for how long. We have made decisions such as the decision to close schools through the end of the year and to close businesses and tell Virginians to stay home through June on what we have learned from our experts. We have watched the national models, primarily those from the University of Washington and the CHIME model from Pennsylvania, which predict how many people will get sick and when. That information is helping states and hospitals predict when and where to prepare for a surge in patients. Those models change daily as our own behavior changes. Our social distancing measures have changed the model's prediction for what we will experience. We wanted something that could take more of our own Virginia-based actions into account. Today, I'm excited that we're able to share a Virginia-specific model. It has been developed by the University of Virginia. Like the other models, it too will change as we move forward depending on our own behavior. Right now, it shows that our social distancing measures are working. We are slowing the spread of this virus. It also shows that right now, Virginia's hospitals have sufficient capacity to handle the surge in patients that we expect. But this model also demonstrates that if we lift the stay-at-home order or social distancing too soon, if we try to rush to get our lives back to normal, the number of cases will spike higher and earlier, and we can't afford that. This demonstrates just how very important it is to continue social distancing. So we need to keep doing what we're doing. For students, this means learning at home. I'd like to tell you about our Department of Education's plans to ensure our students continue to learn. Closing our K-12 schools was a necessary step to protect public health. But I know it has had a profound educational and emotional impact on students, parents, and teachers. I want to thank all of our teachers for their extraordinary efforts to keep students connected with learning during this unprecedented public health crisis. I also want to thank our division superintendents for everything they are doing to operate their divisions safely and compassionately. And I want to thank the frontline staff and volunteers who are getting food to students in every single corner of our Commonwealth. Nothing can replace the exact experience of the classroom, but our teachers and division leaders are doing their best to adapt to the situation we now face. We also risk exacerbating inequities during a time like this, when access to education can be uneven and unequal depending on families' circumstances. Our school leaders all over the state are working hard to address these inequities head on. Today, I'm announcing that the state is making additional educational resources available to all of our teachers and students. First, we are expanding our existing online education platform called Virtual Virginia to allow every teacher in the Commonwealth to host virtual classes. This enables every Virginia public school teacher to share lessons and activities with their students through June the 30th. And for students who don't have internet access, and I know that there are a number of them across our Commonwealth, Virtual Virginia content can be loaded onto devices and used offline. By expanding the use of Virtual Virginia, we will support the efforts already underway by our teachers and help ensure that school closures don't lead to a widening of achievement gaps. In addition, beginning today, 4 Virginia public media stations have launched VA TV Classroom. This will broadcast teacher-led classroom instruction aligned with the Commonwealth's academic standards into homes across our state. And finally, I want to highlight the release of a new guidance document for teachers and schools on high-quality, equitable instruction during this pandemic. Since the schools were closed, the Department of Education convened a continuity of learning task force with more than 120 teachers, administrators, and specialists to issue guidance on how schools can prevent the further widening of achievement gaps and meet the social and emotional needs of students while schools are closed. This guidance has been sent out to our schools and to all of those that have worked so diligently on that. On behalf of our children and their families, I sincerely thank you. Now I'd like to provide an update on our nursing homes and long-term care facilities. Last Friday, I announced that Dr. Lori Forlano is leading a task force to keep close tabs on how our long-term care facilities are faring with this epidemic and ensure they have what they need. In a moment, she will give you an example of how this task force is helping our facilities. Already, we have identified resources to help. One of my budget amendments increases the rates paid to our nursing homes and long-term care facilities by an additional $20 per Medicaid recipient per day. This boost in funding will help these facilities address staffing issues during this epidemic. We're also looking at how our Medical Reserve Corps can potentially help with staffing at our long-term care facilities. And I'll remind all of you that we have had over 13,000 Virginians step up and volunteer for this Health Medical Corps, and I thank you all for doing that as well. This weekend was the constitutional deadline for my administration to act on all the bills that the General Assembly passed during the regular legislative session. We dealt with 1,291 bills, more than any other year in my memory. And we met that deadline Saturday night. One of those bills is our state budget. I proposed 144 amendments to the budget. 83 of them unallot or freeze new discretionary spending of $874.6 million in fiscal year 2021 and $1.4 billion in fiscal year 2022. 49 amendments are language amendments that relax specific requirements and give greater flexibility to our agencies and institutions of higher education as they conduct business during COVID-19. Now, yesterday was Easter Sunday, and I want to thank everyone who found a way to mark the day while adhering to social distancing. Thanks also to those who adhered to our guidelines in our parks and on our beaches across Virginia. I know it can feel like we have already endured the restrictions brought by this epidemic for a long time, and we're going to need to keep living this way for the near future. That is one lesson that the modeling showed us today. The key is for us to keep doing what we're doing. Stay home, stay away from groups, and wash your hands. Right now, distancing is our best tool to fight this. Now I'll turn it over to Virginia Commissioner of Health, Dr. Norm Oliver, for a health update, and then we'll hear from Dr. Laurie Furlano. After that, I'll be happy to take questions. Thank you all.